We have a very active hematopathology service, which means that residents and fellows really learn by doing in hematopathology. We also have a very active clinical trials program here at Vanderbilt, which means that our residents and fellows are really seeing cutting-edge medicine here. We're seeing novel therapies, and as part of our hematopathology work, we're seeing how patients respond to these novel therapies. And residents and fellows who have an interest in research in hematopathology have a number of wonderful faculty to work with. We've got many ongoing research projects involving flow cytometry, molecular testing in hematopathology, and the correlation between genotype and phenotype and how genetics may influence disease outcomes. We have 2 hematopathology fellows each year. They spend time both at Vanderbilt, at the main hospital, and at the VA hospital.
During your VA heme path rotation, you'll look at any of the bone marrows that were done that day, as well as any of the tissues such as lymph nodes, spleen, liver, skin, etc., that might have a heme path diagnosis associated with them. The VA does a lot of transplants, so that includes stem cell transplants and CAR T therapies. If you don't know what that is, that's okay, because we'll teach you when you come over.
We have an online tool that was developed here at Vanderbilt with the input of other hematopathologists and with the assistance of a team of informaticists. And this is an online web tool that basically organizes your report in a way that's dynamic. Through this form, you're able to write a report that comes out in natural language and complete sentences with all the descriptors in the appropriate place, and it might take you 10 to 15 clicks on a web form to create it.
Because there are so many tests that can be ordered and the complexity of that testing is so high, it's challenging for clinicians to know exactly what tests should be ordered at a particular time in a particular patient. And then when the results come back, how do they take all of those results, get them in a single place, correlate them with one another, and come up with sort of a summative or comprehensive diagnosis? And that's where the DMT steps in. We look at the specimen under the microscope, we look at the flow cytometry, and then we give guidance both to what tests should be ordered and how the results should be used.
One of the places where we really are able to have a great deal of graduated responsibilities, and normally our hematopathology fellows, of which we have 2, are responsible for running the clinical flow cytometry lab. However, every resident during their training will have an opportunity on the immunopathology rotation to act at the level as a fellow in running this laboratory. It's a great experience overall. One of the biggest things that senior residents are looking for as they transition to becoming fellows and then faculty is the opportunity to get used to making decisions on their own, and the opportunity to sort of learn how to calibrate their curiosity, their clinical concern for their patient, and their desire to be appropriate consumers of medical resources. And the flow cytometry lab is a perfect place to do that.
We have a great group of people in the hematopathology program, from the attending pathologists on staff to the medical technologists who work on the hematology bench and the bone marrow bench and in the flow cytometry lab, to the administrative staff that help out. We really just have a great group of people who are really fun to work with.